A pleasure to have you join us today on the program Healthy Living. I am Adesuwa-Osa-Uwagie. There is this thing that usually brings fear into the heart of every young woman, whether married or married, particularly those who are of marriageable age or childbearing age, and that is the issue of fibroid. The moment you say fibroid, the next thing you hear is, it is not my portion. Then whose portion is fibroid? This and many more we're going to be looking at today on the program, particularly uterine fibroid. Do you know what it is? Are there signs and symptoms? Do you know what to do when you have the signs and symptoms? Do you even know when to see a doctor? This you should wait to get answers to. With me today is the Medical Director, Saving Grace Hospital on Lagos Expressway here in Benin City. He is Dr. Osamugie Timothy, and we're going to be talking about uterine fibroid. A pleasure to have you join me today, Doctor.
Thank you, ma'am. Okay,
now, this thing called uterine fibroid, in fact, fibroid generally is one medical word women don't want to hear, but unfortunately, it is there. And there's nothing anybody can do about it. It is with the woman, from what I gathered. So tell us, Doc, what is fibroid before we then go to uterine fibroid?
Okay. Well, basically, fibroids is a growth, a benign growth,
okay,
so to speak, that is mostly seen in the uterus of women. And when I say benign, I mean it's a growth that is likely not to become cancerous.
Likely not
to become cancerous.
It might be.
There are rare instances, very rare instances, when that growth
could
become cancerous. But
rare.
In most cases, it's just a benign growth or tumor in the uterus. And statistically, over 70% of women would have it, though a lot of them might never get to know about it because it will not be symptomatic.
Okay.
So it's common in women because women have uterus.
Of course, men don't have. We know that one.
It will be in men.
So it's a woman thing.
Yes, it's a woman thing.
Okay, now you just said that it may be asymptomatic, but how would a woman know that she has fibroid? At least there should be a sign or two. Something must, when something is wrong with a woman, you will know. What should a woman look out for?
Okay, in women of reproductive age.
Yes.
When we say reproductive age, women that are able or capable to reproduce or to have
age,
children.
Whether married or not.
Yes. There are signs and symptoms they could look out for that point to a diagnosis, a likely diagnosis of uterine fibroids. One of them is heavy bleeding.
Okay.
Heavy monthly bleeding, which we call menorrhagia.
Okay.
So when the bleeding, usually during the monthly cycle, is in excess of the normal, a woman should go and check with her doctors to find out if it is uterine fibroids or not. Although there are many other causes of menorrhagia, but one of the common causes is fibroids. Another symptom could be changes in the menstrual pattern, which we call dysmenorrhea. The woman's monthly menstrual pattern can just be distorted. So she does not see it when she's supposed to see it, or she sees it more than she's supposed to see it. That should also be another pointer. Then another one common is, we call them pressure symptoms. That is when the fibroids becomes bigger. Pressure symptoms, you start having abdominal discomfort and bloating and all of that. Increased urinary frequency. She runs to the toilet more often than before, because the mass is growing and it's occupying space and it's compressing on other structures that are in the abdomen. So the woman should suspect such a thing and see her doctors to confirm.
Okay, sometimes when a woman has heavy bleeding, you see them, like I know somebody who used to have heavy bleeding, and then she will say, oh, I took a lot of sugary drink. Does that have anything to do with heavy flow?
There's this misconception in town that a lot of women have heavy flow when they take lots of sugary. Somehow, we might not rule it out completely, but when the bleeding is as heavy in excess of the normal amount, the woman should be worried,
okay,
and she should go and she should go and check up with her doctors. If in the eventuality that she checks up and it's normal, then she's fine.
The truth of the matter is, they say woman would rather go check up with her dressmaker, check up with her makeup artist and all of that, than go to the hospital.
Yes,
except when it is critical.
That is as a result of poor health-seeking behavior, especially in this part of the world. And most of them feel that a visit to the doctors will always cost money. So because of those factors, a lot of persons do not present on time. So they wait till it's a little too late, or when it has gone somehow. That's quite sad.
Okay, what could be the cause or causes of fibroid? Any known cause or
medically, the cause of fibroid is unknown. But however, there are factors that could be pointers to someone who could have fibroid.
Okay, please tell us.
The first pointer is the black race. Any woman from the black race can be predisposed to having uterine fibroids. Another one is a family history. Okay. If the person has had someone in the family that has had fibroid in the past, she could be predisposed to having fibroids. Then another one is nulliparity. When we say nulliparity, it means a woman who is of the reproductive age that has decided for one reason or the other not to have a child yet. Okay. So that is another predisposition for a woman to have uterine fibroids. Okay. It is assumed that in most cases that a uterus that does not harbor children will harbor fibroids. So that is those are some of the risk factors for having uterine fibroids.
Okay, does weight have to do with it too? Maybe
obesity,
yes. Obese.
Yes, women who are obese sometimes too could be predisposed to having uterine fibroids.
Oh, wow. Okay, now let's look at the issue of fibroid and fertility. Often a time you hear people say that a woman could not get pregnant because she has uterine fibroid. And some persons, without consulting the doctor, will say, she thinks that she has uterine fibroid because it happened to somebody, so maybe that's the same thing that's happening to her. So talk to us about the effect or the pains one has to go through when it comes to fertility and fibroid. Does it disturb or aid fertility?
Okay. The truth is that we say there's a causal and a causal relationship between fertility and fibroid, which means that fibroids could cause infertility, and at the same time cannot also cause infertility. It all depends on a lot of factors. Okay. Factors including the site where the fibroid is situated in the uterus. Okay. If it is situated in a place where it blocks the fallopian tubes, and it prevents fertilization from occurring, then we can say, okay, at that point in time, the woman has to get rid of the fibroids to see if that has been the cause of the infertility. Okay. But at the same time, we have also seen women who have these fibroids, even large fibroids, and they also get pregnant and they have children. The only worries in those category of women would be that depending on the location of the fibroids, a vaginal birth might become impractical. Okay, so it has to be a cesarean section. Yes. However, so we cannot actually establish and just say fibroids is the major cause of infertility in such women. But any woman that has infertility concerns and has fibroids needs to see her doctor, her gynecologist, and try and get rid of the fibroids to see if that is what has been the cause. But
we've seen instances where women with fibroid and who are also having infertility issue undergo or have gone through the process of removing the fibroid, yet conception becomes a challenge.
Yeah, that was why I said you cannot pinpoint the fact that a woman is having a fibroid to infertility. Infertility is not a woman thing alone. Okay. Unfortunately, in this part of the world, when a woman is not able to get pregnant, everybody pins it on her. So. They should. There's a male factor in this, and when all factors have been exhaustively looked at, and it has been found that the cause of infertility cannot now be established, and the woman has fibroids, would advise her to check with her doctors and see if that fibroid can be removed before you cannot conclusively say the fibroid is responsible. But however, we can't say fibroids is majorly responsible for the infertility in such women.
Does it get to a point where fibroid kills a woman?
Yes, actually, when it has, when it becomes very massive. Now, I talked about having signs, symptoms like menorrhagia, that's heavy bleeding. When a woman is bleeding heavily every month, and sometimes she's not getting adequate replacement for such blood loss, it inevitably gets to a stage where she has lost enough blood. And if that blood is not replaced, she could have, it could lead to severe anemia and shock, and that could lead to death. At other times, because of the size of the fibroid, sometimes it undergoes other complications like what we call degeneration and all of that, calcification. So the pain and every other thing that results from it, for example, if a fibroid is big enough to compress on the kidneys, on the ureters, there will be a backflow to the kidneys, and that could result in renal failure for the woman, and that could lead to death. So in some cases, fibroids could lead to death from all these things I've explained.
Okay, after a surgical procedure to remove fibroid, is it possible for that fibroid to grow again? And if yes, why? Yes.
Fibroids majorly feed on hormones, the progesterone and the estrogen, especially the ones released by a woman in every of her menstrual cycle.
Yes.
So the reoccurrence of fibroid is very likely after a surgical procedure. So there's every likelihood that the fibroid can grow again. Yes, it is there. Especially when the woman does not now get pregnant immediately after the procedure. So there's every likelihood that the fibroids can grow again.
Like within, what's the time like, you know, from the day of surgery to when it can grow
We can't really put a figure to that. It depends. It varies from woman to woman. And some people take it off and that's it for life. Or it doesn't grow up to the size it grew up to. But there are others that it grows aggressively again. And there's nothing anyone can really do about it.
That hurts.
Yeah.
That hurts. Okay, now this fibroid thing. Now let's look at age, because some persons who are under 20, is it possible for such persons to come up with fibroid? At what age should a woman be wary of fibroid thing? Because I've seen young girls, you know, cry during their period of, you know, severe stomach pains and all of that, and then they feel some kind of lumps in their I don't know how you people say it in your medical line.
First and foremost,
if age has got anything to do with
if a woman is having pain during her menstrual cycle, which is dysmenorrhea, that might not be...
And the bleeding is much.
That might not be caused by fibroid. But however, fibroids are more common in women of reproductive age towards, say, from 30, between 30 and 45. Although in medicine, you never say never. We have also seen cases where you see fibroids in much younger ages.
Really?
Yes. But it's not really common.
Okay.
For example, you said 20. For a woman of 20 and below might not necessarily have a fibroids that are massive at that point in time.
Because that age is also reproductive age.
Yeah, reproductive age. So she has just started her reproductive age, and it has not really, not for long. But however, at maybe ages between, say, 28, 30 or thereabouts, those are the ages where you really find fibroids.
Okay, at a point you said that fibroid is not cancerous. At what point does it become cancerous?
Okay,
if at all, we need to know that at what point does this thing called fibroid become cancerous?
There are subtypes. Actually, fibroid is a benign growth. It's not supposed to get cancerous. But there are times, there's a particular type we call a sarcoma.
Okay, a sarcoma.
Which is very rare, but it happens. That is why it can only be known on histology. That is when this tissue sample is removed or excised from a woman and taken to the lab and examined. That is when it can the particular type of fibroid can be known. That is why it is very good for a woman not to assume she should see her doctors, necessary investigations and imaging studies are done. If a histology has to be done, it is done. An incision has to be done, it is done. And the particular type is known. So that if it's going to be something that will be malignant, it can be easily arrested at the early stage before it becomes too dangerous to try anything or it becomes too late.
Okay, how soon can a woman get pregnant after fibroid procedure? How soon can a woman get pregnant? Because some persons will say, if you do not have a man in your life, don't do fibroid operation. No, I've heard women say that.
Yeah.
If you do not have a man, if you're not ready to get married, if you're not ready to make a baby, do not do fibroid operation, even if that woman is dying in pains, you know? So how soon can a woman get pregnant?
Yeah, after a fibroid surgery, as soon as the woman is fine and is okay, and as soon as her reproductive cycle recommences, she can get pregnant almost immediately. Almost immediately? Yes, she can get pregnant almost immediately. So there is no hard and fast rule to the length of time it takes for her to get pregnant after a successful fibroid surgery or removal. Okay,
fact or a myth? Once a woman starts making babies, the fibroid will disappear or shrink or will not grow again. Is it a fact or a myth?
That is a myth.
It's not a fact.
It's not a fact because we've seen women who, like I said before earlier, who even when they are getting pregnant still have fibroids that are growing. And even with the pregnancy, they grow faster because the hormones are there to encourage their growth. So it's not a fact that the fibroids will regress once the woman is having children. Pregnant. The only time the fibroids start regressing is when the woman has gotten to menopause, has attained menopause.
Okay, so menopause kills it
because the hormones are no longer there, so to speak, in sufficient quantities to encourage the growth of the fibroids. The fibroid starts regressing and shrinks.
Okay, I read from somewhere that the permanent cure to fibroid is hysterectomy.
Yeah, that is a hysterectomy. That is a surgical removal of the uterus.
Of the uterus, everything.
Yes, but however, that is the ideal cure for fibroid is hysterectomy, as removal of the uterus or the womb, so to speak. But however, we individualize cases. For example, a woman who has not completed family size or has not had any children at all, especially in this part of the world where we value children a great deal. So, and one is mostly rated with how many children you have as a woman. So for a woman who has not had any children at all or who has not completed family size, you don't want to advise such a woman to have hysterectomy. There's another option we call a myomectomy, which is a surgical incision on the uterus to remove just the fibroids or the segments where the fibroids are and still salvage the uterus with the hope that this woman will still get pregnant or still have children.
Okay, that's some cheering news there. Okay, if you're just joining us, the program is Healthy Living on Independent Television, and I'm speaking with Dr. Osamugie Timothy, Medical Director, Saving Grace Hospital, our neighbor here in Oluku, and so we are doing this thing. So if you want to continue with this conversation after now, please call 080-392-88 308. I'll call that number again, 080-392-88-308. Now, Dr. Timothy, let's look at a lifestyle. Does lifestyle, what we eat, what we drink, have anything to do with fibroid? You know, at least.
Actually, you cannot really distance lifestyle from fibroids. Like one of the risk factors we talked about just now was obesity, and we all know what predisposes one to obesity. Sometimes, though it's genetic, but however, the food intake, and the kind of foods one take can also predispose one to, and living a sedentary lifestyle. So lifestyle would, yes, can actually be implicated or a risk factor. Lifestyles like smoking for women. Like in contemporary times now, we have a lot of women who smoke. They smoke. Smoking, living sedentary lifestyles, not doing enough exercises, and eating a lot of junk, and not keeping fit. Keeping to shape can predispose one to obesity, and that one is also a major risk factor for developing uterine fibroids.
So we have to be very careful what we do.
Yes.
Now, before I let you go, can fibroid be prevented? Because you did tell us already that if there's a family history, so somebody may just come down with it, okay? So we can say something about bloodline when it comes to fibroid. Now, what can we do to prevent fibroid, if at all it's preventable?
Okay, one of the things, like I said earlier, that a lot of women, at least 70% of women in their lifetime, will have fibroids. But the good news is that a great deal of them might not even know, because the fibroids will remain asymptomatic. And there are many cases where a woman has fibroids that you don't even need to do anything about it, because it is not disturbing her.
Really?
Neither is it hindering her chances of fertility or anything.
So you
don't do anything about it. You just we call that conservative management. You just leave it. You just let it be.
Okay.
So most women would have, 7 out of 10 women will have fibroids, and majority may not even know. So it's not something you can really prevent in the sense of preventing it. But however, you could avoid the risk factors that predisposes one to having it, like things that can predispose one to being obese, totally avoiding smoking in women, eating junk foods, and when you now also know that it's something in your family, you could also go for regular checks to know if you have started developing this thing. Not that it's something that you can actually stop from growing. But however, some women know they have fibroid accidentally when they just go for an investigation that was completely unrelated, and they become disturbed or worried unnecessarily. Meanwhile, the fibroids was just there innocently. So those women become disturbed. Sometimes there's something you can do to convince them otherwise that fibroid will not affect them. So when they start having other issues like infertility and others, they will always point to the fibroid that they saw maybe in that scan they went to do or something.
Okay, don't press for time, but let's quickly do this in a minute or so. You know, sometimes when you're going through the net, you just see some stuff will just pop up. If you're a woman, you're suffering from fibroid, there's no need to do surgery. If you take this leaf, mix it with that leaf, it will shrink. They now start prescribing all sort of herbal mixture. What's your take on all of this?
I would advise every woman to see her doctor when she has a history or a case or suspected fibroids. Those things it has proven not to be effective. There is the only known management of fibroid. Fine, there are medical ways of also managing fibroid too. Okay. Yes, there are medical ways of managing fibroids too.
Not necessarily
surgical.
Okay,
yeah.
That's good to know.
Yeah, there's conservative, there's the medical and the surgical methods. But taking herbs, I've seen a lot of patients who have gone that way, and they come back even worse off. And some will even say that the woman will birth the fibroid. After taking that mixture, she will birth That is a serious
fibroid.
A serious fallacy. There is no known herbal or a cure, a tradomedical cure you take, and though many claims are out there, they have not been proven. That's just the truth.
So every woman should be watching. You know that a lot of us women like our phone so much, and so when anything pops up, they should be watchful
of such bogus claims. It's not just peculiar to fibroid. A lot of actually those people, when you see the first alarm when you see such bogus claims is that those people tell you one medication or one product can cure so many things, and that you now begin to wonder or worry what is the science behind this particular, so to speak, wonder drug that cures all ailments or that takes care of all ailments. From experience, a lot of women who go through this still come back sometimes worse off.
Wow. So medically, fibroid can be treated?
Yes. There are medical regimens for managing fibroids. Like I said, there are 3 major ways of managing fibroid. The first is the conservative method, like I said. Most fibroids will not cause any harm to the woman, it will not disturb her.
Okay, that's some terrible
But just that many women will not be comfortable with the fact that they have fibroids and they're not doing anything about it. Then there's a medical aspect, and then finally there's the surgical aspect.
Okay, Dr. Semege Timothy, I want to say thank you for finding time to be with us on the program. I'm sure we've done quite a lot, and that woman there listening or watching who has been very weary and tired and angry and upset and very sad about having fibroid will have some respite this afternoon. So do us a call on 080-39288-308. 080-39288-308. Call us and then we'll continue from where we stopped today. We'll see you again on Monday on the program Healthy Living. Bye-bye.